Okay. Good afternoon po everyone. Isang malusog at mapagpalang hapon, Healthy Pilipinas. Ako si Kath Bitog ng Health Promotion Bureau ng Department of Health. Kasama ko ang aking napakagandang partner mula sa Commission on Population and Development na si Mike Kiray.
Magandang hapon at masayang pamilya. Ako si Mike Kiray ng Komisyon sa Populasyon at Nagpapaunlad o POPCOM at kami ang inyong hosts for today.
We are here today for our Usap Tayo sa Family Planning Experts, a joint dialogue of the Department of Health and the Commission on Population and Development. Joining us today are guests from the Department of Health, Disease Prevention and Control Bureau, Health Promotion Bureau, Commission on Population and Development, U.S. Agency for International Development, and Filipino Shell Foundation Incorporated. So Mamay, alam mo naman natin kung gaano nga kaimportante ang mga dialogue at mga pakikipag-usap para ma-achieve natin, makamit natin ng isang masayang pamilya sa Healthy Pilipinas. Kaya taos-puso po kaming nagpapasalamat sa pagbibigay ng inyong oras ngayong hapon. So this dialogue po is being streamed live on the official DOH digital platforms at syempre sa POPCOM digital platforms din natin sa mga hindi po nakahabol sa ating registration. So before we begin po, we would like to remind everybody following a few event guidelines. So this of course po para ma-minimize ang ating disruptions at magkaroon po tayo ng maayos na daloy na ating programa. So una po, kindly rename yourself to include your name po and your organization or agency. And pangalawa po, kindly keep your microphones on mute until you are engaged po. And syempre po, kindly register for this event by filling out the attendance sheet. Link for the is in our chat box po, And syempre po, para tuloy-tuloy ang ating daloy ng usapan, kindly reserve your questions po until our question and answer portion later. And alternatively din po, you may put your questions in the chat box and we will address them po during the dialogue proper. And of course, if possible po, we encourage everyone to keep your video cameras on for you to be recognized. So please use our Usap Tayo sa Family Planning at iba pa, Zoom background. So you may find po the link of the Zoom background in our chat box, So kindly download lang po and upload as your background here in the Zoom platform. And lastly po, we would like to inform everyone din po na magbibigay tayo ng certificates para sa session na to for those po na makakomplete ng pag-fill out ng ating attendance sheet as well as ng ating evaluation sheet at the latter part of the program po. Okay, now that we are done na po with a few reminders, gusto ko namang tanongin ang aking magandang partner, Ma'am Mike Kiray. What are you excited about ba sa event natin ngayon?
Ayun, maraming salamat sa aking magandang partner na si Kat. Excited talaga ako kasi we are again in this partnership as co-managers of the National Program on Family Planning. Andito na naman ang DOH at POPCOM para i-promote ang open conversations at usap tayo sa family planning, lalong-lalo na yung mga benepisyo at paano ito makakatulong at magpoprotekta ng isang pamilya. And of course, this dialogue is really for young people. That's why we welcome all of you here and even yung mga stakeholders natin na yung sa mga kabataan natin, you are very welcome here. And kaya nga isinusulong talaga natin ang usap tayo sa family planning dahil ang pamilyang planado, protektado. So talagang yan na talaga ang ating core message, ang ating tagline. Kasama natin sa araw na ito ang Executive Director ng Commission on Population and Development, si Undersecretary Juan Antonio Perez III, si Doc GP, ang DOH Family Planning Program Manager na si Doc Jan Llevado para magsimula ng ating mga usapan para protektado ang ating pamilya. Dahil nga ang pamilyang planado protektado, kaya we are very honored and privileged to have all our FP experts here today. Partner Kat?
Ako naman, Ma'am May, alam mo, excited naman ako ngayon malaman kung ano-ano nga ba yung mga benepisyo at roles ng family planning, no, sa pag-address ng HIV epidemic sa bansa, no, at sa pagkamit nga ng isang HIV-free Philippines. Kaya nga isa nga sa battle cry natin ay ang usap tayo sa FP para sa HIV-free Pinas. So kaya naman pribilehiyo din po nating makasama ngayong araw si Dr. Stella Flores at Mr. Darwin Tenoria ng Filipina Shell Foundation at si Miss Elena Felix, no, founder and vice president of Association of Positive Women Advocates Incorporated. And of course, sina Miss Kling Malaco and Miss Dasha Uy, both from the Health Promotion Bureau of the Department of Health.
Right, no, it is indeed a privilege to have all of them here from DOH, POPCOM, at Filipina Shell Foundation. Also, my partner Kat, we'd like to thank everyone who joined us today from national government agencies, from our civil society organizations, our local partners from health offices and our population offices, no, ang ating mga bayani sa lokal na level. Maraming salamat po. Kat?
Tama, Ma'am Mai. That is so right. So I'm pretty sure, Ma'am, excited na rin ang ating participants, no, sa ating programa ngayong araw. At syempre, naghanda rin kami ng exciting and fun mini games, no, in between sa ating usapan sessions with our FP experts. So stay tuned and make sure to actively listen, no, dahil magkakaroon tayo ng 5 winners ng 200 peso worth of load. Kaya naman sumali na sa ating usapan, no, sa ating FP experts, because you will not just be informed, but also will have fun pa while doing so. And Mamay,
Yes.
bago
Yes,
natin
my partner.
ating usapan, may gusto ko bang malaman sa ating participants ngayong araw?
Yes, meron. We'd also like to thank pala before we proceed our partners, no, from donor agencies. Nakikita natin sila, our partners from the media. Maraming salamat po for joining us today. So we'd like to ask everyone, tell us naman, ano ba ang unang pumapasok sa inyong mga minds kapag naririnig niyo yung word na family planning? Tell us your hashtag and let's use this chat box, no? And there, sa mga nanonood sa atin sa ating mga online platforms, join us in this conversation. Tell us, ano yung hashtag nyo when you hear the word family planning? We'd like to hear from you. Also, yung mga kabataan natin, nais naming makarinig mula sa inyo. Kaya please, let's use yung chat box, no? Andyan yung mga keyboard warriors also natin, partner Kat. So napakadami ng nakalagay dito. Pop-ed, be a responsible parent, wise decision. I love that, partner Kat. Modern contraceptive methods, informed choice, and volunteerism. Happy! Birth control. Family planning is safe. Plan for a happy life. Ang dami. Maraming salamat for joining us. Ano pa bang nakikita natin dito, Kat? My family, my choice.
Hashtag safety first, no? Hashtag shared responsibility. O, diba?
Hashtag people and development. I love that. No?
Hashtag respect life.
Yeah, and my family, my choice. So when I hear the word family planning, for me, it's really empowering ang ating mga pamilyang Pilipino. Kasi kami sa POPCOM, we empower Filipino families. Kaya yun talaga ang aking hashtag when I hear the word family planning. Oh, my family planning is sacred. No? And it's really a couple's choice. Alright, ikaw ba, my dear partner, when you hear the word family planning?
Mamay, kapag narinig ko talaga yung family planning, kagaya nga ni Sir Renz dito, hashtag protect, hashtag protect yourself, no? Protection. So protection nga, pag naisip ko, protection sa hindi inaasahang pagbubuntis, protection sa sexually transmitted infection, no? So double protection. Diba?
Yes, and shared responsibility, protection for every families. So may nag-message dito sa atin, nag-invite ng partners ang kasama natin na sila Tita Edna mula sa Seabird, HPB DOH. Also, ang ating mga partners galing sa national government agencies na nakikita natin ngayon, ang ating mga POPCOM offices, mga regional directors na nandito, partner Kat.
Maraming salamat po sa pag-attend ng ating event ngayong araw. Okay.
Napakadami natin. Later po, we will acknowledge all of you later in the program kasi napakadami nating nag-join. No? Salamat po talaga. And ating mga kabataan, maraming salamat sa inyo.
Maraming salamat, Ma'am Mai. Maraming salamat sa ating participants. All right, no? Maraming salamat din po sa pag-share ng inyong hashtag sa family planning. Okay, without further ado, to formally begin this joint dialogue of DOH and POPCOM, we are joined by our Secretary of Health, Dr. Francisco T. Duque III, to give his opening message.
As the COVID-19 pandemic continues to loom over the globe, the utter enormity of its scale has impacted even the reproductive behaviors of individuals. Thus, it is paramount that we ensure that family planning services and other essential sexual and reproductive health services are continually accessible by the public. These health services need to continue both in the community and in health facilities. However, more than that, we need to take the steps necessary to promote greater openness towards these topics. The observance of the Family Planning Month this August underscores the value of having honest and open conversations about topics that matter, regardless of how difficult they might seem. The concept and profound act of pakikipag-usap and pakikipagkapwa paved the way towards masayang pamilya and healthy Pilipinas, and uphold the Filipino spirit of being sensitive and non-discriminatory of the needs of others, regardless of who they are or where they come from. Through conversation, we ultimately create awareness on the importance and benefits of family planning in promoting the overall health and well-being of the population. And while the Philippines remains a rather conservative society, the forward march of time's arrow has slowly opened conversations on the realities that surround modern life. The persisting concern over our finite resources, as well as prevailing social inequities, require conversations on family planning, sexual and reproductive health, and HIV. Beyond that, we need to recognize that if we are to truly erase the stigma and discrimination that have systemically plagued these topics, then we must allow for these conversations to be encouraged within our families. As a society, we need to recognize that hiding from these topics behind a veil of politeness or puritanism no longer provides our society with any benefit. Genuine and supportive communication is key to the true health and well-being of the Filipino family. I extend my felicitations and gratitude to the Health Promotion Bureau of the DOH and to our partners in the Commission on Population for their indefatigable facilitation of all the activities slated for this month that demonstrate compassion to others, understanding of people's medical conditions, and support to end inequalities to achieve an HIV-free Philippines. May we be relentless in our pursuit of stimulating open discussions that promote masayang pamilya and healthy Pilipinas. Kaya mag-usap tayo para sa masayang pamilya at sabay-sabay natin abutin ang healthy Pilipinas.
Kaya sama-sama tayo at usap tayo para sa masayang pamilya at sabay-sabay nating abutin ang healthy Pilipinas. Indeed, as Secretary Duque mentioned, no, through conversations, we ultimately create awareness on the importance and benefits of family planning in promoting overall health, no, and well-being of the Filipino population. Thank you very much, Secretary Duque. Okay, no? Before we formally begin our discussion proper, I would like to acknowledge the presence of Mr. Sean Callahan, the acting U.S. Agency for International Development Mission Director for the Philippines, Pacific Islands, and Mongolia, posted to Manila. Ladies and gentlemen, please welcome Acting Mission Director for USAID Philippines, Mr. Sean Callahan. Mr. Sean, the floor is now yours.
You're on mute, sir.
Okay, there we go. Okay. Thank you very much for being here today. And my name is Sean Callahan. As you heard, I am the acting mission director for USAID Philippines, Pacific Islands, and Mongolia. And I first want to acknowledge and thank the Honorable Secretary Francisco Duque, Secretary of the Department of Health, as well as our other distinguished guests under Secretary Juan Antonio Perez, and all the officials and representatives from the Department of Health, the Commission on Health, Population Development, the Filipinos Shell Foundation, civil society, friends, partners, media, and everyone. And as the Secretary said, I like the idea, the theme of being relentless, and being relentless in family planning, fighting HIV/AIDS, tuberculosis, all the other health challenges that are facing the Philippines and the Filipino people today. So I do think that that term relentless is a great description of the Secretary's goals and everyone here today fighting against all these different health challenges. But today we want to celebrate all these great activities in terms of and celebrating Family Planning Month today. This year also for USAID also and for the US government, it marks the 75th anniversary of the establishment of diplomatic relations between our two countries and the 60th anniversary of USAID in the Philippines. As one of our enduring partners, USAID has worked with the Philippine government and local organizations to achieve shared development goals, investing more than 247.5 billion pesos to support the Philippines since 1961. In the areas of health, particularly in family planning, we've been working with the Department of Health and the Population Commission to improve women's and children's health and rights, increase open opportunities for women, and promote individual rights to decide their own family size. Since 2012, USAID has invested over 6 billion pesos in financial and technical assistance to support DOH's family planning and maternal and child health programs. We work with national and local governments partners, as well as the private sector and CSOs, to increase the demand for and access to high quality family planning supplies and services. We all share the belief that family planning saves lives, improves health, and empowers women. And it is crucial to ending preventable child and maternal deaths. As many of you know here today, the Philippines has recorded an annual population growth of an estimated 1.63% in 2020. One of the highest rates in Southeast Asia. Unfortunately, the COVID-19 pandemic has greatly affected the continuity of essential health services, including family planning, to meet this demand, resulting in less than adequate uptake of family planning. The documented gap between the desired number of 2 children per family and the actual average of 3 children per family signals here in the Philippines that many women want to space or limit their pregnancies, but do not have adequate information or access to family planning services. Why is this? Research conducted by our Reach Health project revealed that there are still pervasive misconceptions about family planning methods, and that many women are fearful and anxious about family planning. This can and must be rectified. We hope that with the Department of Health and the POPCOM online dialogue, focusing on the many benefits and issues of family planning and safety, that more people will be encouraged to express their concerns to their health providers, ask questions, discuss this with their families and friends, and decide on acceptable methods for family planning. So I look forward to today's event, and I look forward to all of us being relentless in family planning across the Philippines. Thank you very much. All the best.
Thank you very much, Sean Callahan, Acting Mission Director of USAID to the Philippines. And now, to proceed to the next part of the dialogue, I am now giving the floor to my pretty partner, Ms. Maiti Rai of Commission on Population and Development.
Thank you very much, my dear Kat. No, relentless. We love that word. So thank you po for that word for the day for me, relentless. It can also mean being relentless in family planning. Ano? So for this event with our family planning experts, we will briefly discuss topics surrounding family planning, and then magkakaroon din tayo ng game break. So ang ating mga kabataan na participant, you are encouraged to join that para makakuha kayo ng 200 peso worth of load. No, so but you have to listen talaga to our FP experts who will discuss their topics kasi yun talaga yung aming itatanong sa inyo for today. And then also we'd like to acknowledge our POPCOM Executive Director Juan Antonio Perez III, our Deputy Executive Director Boyet Tacardon, who's here with us today, and our regional directors and our executive committee and staff. And without further ado, let us all welcome and hear from the Undersecretary of the Commission on Population and Development, our beloved Juan Antonio G.P. Perez III, a medical doctor and a public servant who has had over 33 years of experience in public and private sector health programs in the Philippines. He has headed the Commission on Population and Development as Executive Director since September 2013, and he has managed substantial programs for the DOH, for the USAID, the World Bank, the Asian Development Bank, and a lot of others, and a key person in the implementation of the Responsible Parenthood and Reproductive Health Law in the country. Friends, ladies and gentlemen, ang ating mga kabataan, please welcome our beloved Executive Director, Undersecretary Juan Antonio Perez III. Doc GP, over to you.
Thank you, Mai and Kat, for your facilitation. Magandang hapon, masayang pamilya para sa isang healthy Pilipinas sa ating lahat. Ngayong National Family Planning Month. I thank Secretary Duque for his kind words and introducing into our lexicon the words relentless and family planning. That's an important, they have to go together. And of course, thank you also to the Acting Mission Director, Sean Callahan, for his words of support. USAID has been a steady and consistent partner of the Department of Health and the country in our work towards a healthier population. Ever since I started working in DOH back in the 90s. So that's some time ago. Of course, I'm happy to be in the presence of other experts here. Dr. John Livado of DOH, who heads the family planning program. Dr. Stella Marie of Pilipinas Shell, and Dacia and Kling of the Health Promotion Bureau. But I'm here to talk about a new aspect in our work in sexual reproductive health, in implementing the RPRH law. And a new companion piece to that is Executive Order number 141, which was just signed by the President over a month ago, June 25, at the prodding of the Commission on Population and Development, which is chaired by Secretary Chua of NEDA and co-chaired by Secretary Duque of DOH. This executive order was issued after NEDA and the Commission and DOH and many other agencies called for action to address increasing teen pregnancy in the Philippines. So the background of this is, of course, if you look at all the plans of the country, you have the RPRH law, which is being implemented by a national implementation team led by Usap in DOH, and supported by POPCOM and many other agencies. And you have the long-term Philippine Development Plan 2017-2022, which has included the the intensified implementation of the RPRH law as a basic foundation of the Philippine Development Plan. And finally, you have the Philippine Youth Development Plan from the National Youth Commission, which seeks to address as one of the key areas of concern of young people today, the issue of teen pregnancies. So all of these three policies are looking at addressing sexual reproductive health needs and priorities of young people as well as the entire population of the country. Next slide. Now, why is adolescent pregnancy being put forward by agencies like POPCOM, DOH, and many others? No? We will note that in the past 5 years, 4 years actually, going back to 2016 with data, we have seen that live births among adolescents have gone up to more than 207,000 in 2016, but it has declined somewhat, but still a significant number at 178,000 in 2019. That is still over almost 500 adolescents giving birth every year. But what has persisted over time is the live births among 10 to 14 years old girls, which has gone up to 2,000 from a beginning figure of around 1,100 back in 2011. So it has gone from 3 live births a day in the 2010s among 10 to 14 to 7 live births a day to 10 to 14-year-old children. So these are trends that the country, the government cannot neglect and cannot ignore. So next slide. On top of all of these emerging concerns from 2016 onward, we have also noted the potential impact of the 2020 COVID-19 pandemic to possibly higher numbers of adolescent pregnancies. UP Population Institute has said that this can increase by up to 20%. And most recently, I was in discussion with Professor Grace Cruz, and she said, well, this is more likely to happen for those adolescents who are heads of families and are living in with their partner. A second, a third pregnancy might even be the picture for these adolescents who are heading families, and the number is around 166,000 this year. And of course, there is an economic cost to being a batang ina. No? The losses to the cohort of batang ina who turn 18 is that they will not be able to earn as much as their counterparts who did not get pregnant. They will, as a matter of fact, lose up to 33 billion in terms of income, foregone income for this group. So this is a consequence in terms of health and socioeconomic situations that we cannot ignore and that we should address. Next slide. So that the government response is to address the root causes of teen pregnancy, so that we have, as a result, 25 million well-informed, empowered, healthy, responsible adolescents. And we will achieve that by the 5 pillars that will be part of our effort to address this phenomenon. Number 1 is comprehensive sexuality education in our public schools and as well our communities. And EO 141 specifically asks Sangguniang Kabataan, the National Youth Commission, to take action to address this matter at the community level. So you will have a partnership between public schools and communities, with the young people themselves being part of the solution. We cannot address teen pregnancy without giving them information on reproductive health as well as services. And these services we are highlighting this month, which is Family Planning Month, will include family planning services for adolescents who need it, for adolescents to evade a repeat pregnancy in particular. And there will also be maternal, newborn, child, adolescent health and nutrition services. Nutrition being a key element again here, as a young mother is more likely going to have a low birth weight infant who might, down the line, lead to stunting. So stunting leads to poor educational outcomes. So magkakadikit-dikit. There is a train of events that happens when one is a young mother with a child that needs support as well. And we are looking also at access to anti-violence against women and children services. We note that violence is very often a part of an adolescent pregnancy. Adolescents report the highest number of incidents of violence, physical violence. And we also note that the 10 to 14-year-old pregnancies are also accompanied by a form of violence, particularly yung 10 to 12, where you are seeing statutory rape if the pregnancy is delivered at 12.75 years old. That means a rape happened when the child was 12 years old or younger. We must also provide for a good outcome for these teenage mothers, these young mothers who are often living in rural areas with poor socioeconomic background. So there must be socioeconomic interventions by the SWD, by the local governments themselves, and by the DOH and POPCOM and other agencies that can support it. Finally, youth participation and development, led by the National Youth Commission, will lead to the best possible outcome for these adolescents. Even if they have become teenage mothers, they should have a better outcome in their future. Next slide. So this is actually a roadmap of how we will achieve what I talked about, with the impact happening because we can improve child, adolescent health and nutrition, with improved quality education and skills, with improved employment outcomes for young people. Young people are the most have the highest unemployment rates in the country. So we need to address all of that and increase investment for child development. And all of this will happen if we follow, if we are able to put in place the 5 pillars of services that will be based on good governance. We should have a good information system and the support of the entire community. Next slide. And I believe that is the end of my discussion. So thank you very much. Magandang hapon sa inyong lahat. Let's all help to empower Filipino families, particularly those that are led by the young people in our communities. Thank you very much. Magandang hapon.
Young Pamilya, para sa Healthy Pilipinas, ang aming beloved Executive Director, Undersecretary Juan Antonio Perez III. Truly, ito pong Executive Order 141, ipupush natin yan kasi ang teenage pregnancy ay isang urgent national priority. Kaya po, tayong mga kabataan na nandito, sinama ko aking sarili, no, we are in the best position to make a difference in the lives of our fellow kabataan. And all the stakeholders here present, you are in the best position also to make a difference in the lives of our young people. available. And we'd like to thank all 383 of us and all 68 watching on our online platform. So we are 400 plus at maraming salamat kasi alam namin, nakikita namin ang inyong pagmamahal para sa ating mga kabataang Pilipino. At para tayo ay mag-usap sa family planning. Right? My partner, Kat, over to you.
Right, Mamay. Thank you so much, Yusek GP and Mamay. No, EO141, push natin yan. Okay, now at this point, we are joined by a physician and a health policy development and local health systems strengthening practitioner, an advocate for family planning, maternal and child health, and a certified trainer no, in the integrated management of acute malnutrition and essential intrapartum newborn care. And of course, a breastfeeding counselor at Latch Philippines. Ladies and gentlemen, ang ating very passionate at super galing na family planning program manager ng Department of Health, Disease Prevention and Control Bureau, Dr. Jan Aura Laurel Liavado. Dr. Jan, over to you.
Thank you, Kat. Magandang hapon po sa ating lahat. Good afternoon, Doc GP and all the partners, national government agencies, LGUs who are here with us. And also, I think, baka may clients din na nanonood sa atin. Hello, sir. Magandang hapon po. So, I took a break from the hearing. So, good afternoon. So, I will be discussing this afternoon ano nga ba ang mga benepisyo no, ng family planning. I know karamihan sa atin, if not all, I think all of us know the benefits of of family planning, kundi hindi talaga tayo nandito kung hindi natin alam yun. Baka kailangan lang i-reiterate and advocate no, and i-remind natin yung ating mga sarili na ang nandito siguro sa mga next slides na to ay very important for counseling our clients. Okay, so syempre umpisahan natin, ano ang family planning? So just a review for all of us. Family planning is an essential intervention to promote the well-being and autonomy of women. Not just them, but of course their families, their communities, by empowering women to choose if and when to become pregnant. So take note po yung word na empowering. So technically, we just mean it's really the rights of women, men, and couples to choose and to choose what family planning methods they need. Pregnancies. Of course, there are women who would want women and couples who would want to space or who would want to either space or limit pregnancies. Lastly, family planning achieved through use of contraceptive methods and treatment of infertility. So hindi lamang po pinipigilan ang pagbubuntis ng family planning methods, pero ang family planning in general ay gusto din natin magkaroon ng desired family size. So kung meron tayong mga problema sa ating fertility, ginagamot po natin yon. In fact, one of the elements of the RPRH law is actually treatment of infertility. Pero dito sa Pilipinas, ito ay nananatili muna sa private sector dahil mataas no ang igugugol nating budget for this. Suffice it to say, it's not just limiting and spacing of pregnancies, but it's actually planning our family. So it actually involves treatment of infertility for those who have fertility issues. Next, please. So ito, nandito sa mga social media cards natin na pinapakita natin sa Healthy Pilipinas kung bakit nga ba mahalaga ang pagpaplano ng pamilya. So, nandito, hindi klarado sa akin, pero ayan, para sa ating mga anak, para makapag-save tayo. And of course, on the other side of the social media card, ito na yung para masugpo ang HIV. So alam natin may isang family planning method na nakakapagpigil no ng pagkalat ng HIV, yun ang condom. So sa mga kababaihan naman, pinipigilan niya ang transmission, mother to child transmission ng HIV, and of course transmission din sa partners. So ang condom ay ang natatanging family planning method that actually prevents HIV. Next please. So ngayon, bigyan natin ng substance no kung bakit nga ba mataas ang benepisyo ng family planning sa ating kalusugan. So ito yung mga reasons talaga kung bakit ginagawa natin ang family planning sa kagawaran ng kalusugan pati sa mga local government units. So ang family planning kasi ay isa sa pinaka mabisang pamamaraan para ma-reduce ang maternal mortality and morbidity, and of course, to reduce neonatal and infant and child mortality. So paano nga ba natin binabawasan o paano nga ba nakakatulong sa pagbawas ng maternal mortality ang family planning? For one, reduction in the number of births. Secondly, prevention of unintended pregnancies that leads to abortion. Alam natin na karamihan ng ating mga maternal mortality ay galing sa unsafe abortion. Pangatlo, prevention of high-risk pregnancies, grand multiparity, teenage pregnancies, older age, repeat operative delivery, and pregnancies complicated by conditions. So, i-relate ko na sa sarili ko na ako mismo, nagkaroon ako ng unmet need for my third pregnancy. So, I had pre-eclampsia. So, hindi natin talaga masasabi kahit kumpleto ang ating antenatal care and all that, it's very important to take care of ourselves, and very important talaga ang proper timing and spacing of pregnancies. Secondly, family planning helps us in reduction of neonatal, infant, and child mortality. So, bakit nga ba namamatay ang mga infants no if closely spaced yung pregnancies natin? Technically, babies who have increased risk of dying before their first birthday generally comes from three broad categories of children. So una, yung children na births to adolescents. So yung sobrang bata. Kasi alam natin, immature pa yung kanilang body, hindi pa ready really to take on that pregnancy. Second category or group naman ng births ay those births coming from older women o yung 40 plus na. So this naman, ito na yung mga nagsasuffer ng preeclampsia, anemia, and of course, yung depletion lang talaga ng ating mga physical strength ng ating katawan. Siyempre, if you're pregnant, kaya nga tayo nagsusupplement ng iron, calcium, because we are depleted with these minerals in our body. So it's very important to replenish this in order for the women, no, for the mom to be healthy. Lastly, yung isang broad category for this are those coming from closely spaced births. Okay, so isa ding dahilan kung bakit mataas ang risk for infant mortality, it's because increased interpregnancy intervals will lead to longer breastfeeding and better childcare. Ito yung kabaliktaran. So kung closely spaced pregnancies, hindi maganda ang breastfeeding and childcare ng mga bata. Okay? So better maternal health also leads to reduced risk of stillbirth and low birth weight. So makikita natin, no, sa ating mga rural health units or hospital facilities, kung may mga children born to adolescents, they are really at high risk for low birth weight babies. Next, please. Okay, so ano nga ba ang ibang benepisyo ng family planning sa kalusugan? Okay, so ito hindi ko na iisa-isahin kasi alam ko sa mga service providers natin, dumadaan kayo sa training for FPCBT 1 and 2 and sinasabi ito dito. Pero basically, these are the benefits of certain family planning methods to women who are actually using it. No? So for example, for combined oral contraceptive, you have reduced risks of cancers like endometrial cancer, ovarian cancer, or even symptomatic pelvic inflammatory diseases. For BMPA, similarly, you have decreased risk of endometrial cancer or even uterine fibroids. No? How about condoms? Yung sinabi na natin kanina, reduced risk of STIs, including HIV and other complications. Okay, so marami ding benefits no ang ating mga specific family planning methods to women. Next, please. Okay, so next, ang gusto nating malaman, kung gumagamit tayo ng family planning methods, ano naman ang epekto nito sa fertility and sa population natin? So I know dapat si Doc GP ang nagdi-discuss nito, but in our previous kick-off, no, diniscuss niya ito kung anong effect ng fertility sa population. But suffice it to say, with the fertility which declines, it is actually associated with increase in women's education, health, earnings, and participation in paid employment, better access to health, education, and employment for children. So may mga pag-aaral po sa buong anong tawag, daigdig, no, na ang paggamit talaga ng family planning or longer birth spacing ay tumatagal ang isang pupil or isang student sa paaralan. Kasi kung lesser ang birth space nila o sunod-sunod ang pag-aanak ng isang nanay, madalas nagda-drop out yung mga batang ito. So it actually increases not just the women, but actually her child's education. Kung mataas naman or mahaba naman ang space ng pregnancy, nakakapagtrabaho ang mga nanay because naiiwan nila yung mga batang lumalaki. So, hindi dapat taon-taon may baby yung mommy, so hindi siya nakakapagtrabaho. Next, these combined effects can, go back please. So, these combined effects can lead actually to large macroeconomic demographic benefits or yung pinupush natin lahat, lalo na ang opisina ni Doc GP, ang demographic dividend. Prolonged fertility declines with increasing life expectancy can lead to, so ito naman ang ayaw naman natin itong mangyari. Aging population, no, that is dependent on few workers and higher healthcare costs. So kailangan din natin i-balance yung ating paggamit ng family planning. Kaya nire-respeto natin ang choices ng ating mga kapabilihan, hindi actually natin sila kino-curse these family planning methods because we wanted our fertility rate to be just as normal or just at 2.1, hindi na talaga bababa to lower than that because we will be having an aging population. Okay, next please. So ano naman ang epekto ng mabilis na pagtaas ng population sa ekonomiya at kapaligiran? So of course, kung marami ng population no, sa isang bansa, for one, there is small productive population supporting a large dependent population. So, syempre, kung anak tayo ng anak, marami tayong live births in a year. So we support a largely dependent population. So we wouldn't want that. Gusto natin mas maraming workers, no? And para mataas ang economic productivity natin. Next, communicable diseases in a dense population. So imagine if in a certain area, dense ang population niya, we are at risk for contracting tuberculosis. Now that it's COVID-19 pandemic, I know the Commission on Population and Development have a study on certain areas that are dense, no? So for example, sabi ni Doc GP, sa Addition Hill, sa Mandaluyong, mataas ang COVID-19 infectivity dahil mas dense ang population sa mga areas na yon. Okay. Lastly, habitat destruction. May effects din ang mataas na population natin sa ating kapaligiran or environment. Shortages of energy and other natural resources and conflict over scarce resources. Next, please. Okay, so Ito naman, after nung mga benefits natin sa family planning, gusto ko naman bigyan ng emphasis, no, yung contraceptive effectiveness. So ano nga ba yung mga iba't ibang paraan ng family planning natin which can actually promote proper birth spacing and limiting of pregnancies. So kung makikita natin dito, ito ay nanggaling sa bagong family planning handbook, hindi talaga siya bago. Back in 2018, yung ating FP handbook, no, makikita natin na implants, vasectomy, female sterilization, and IUD has really the highest, no, contraceptive effectiveness with correct and consistent use. And even though they're commonly used as well, mataas talaga ang kanilang contraceptive effectiveness. So during our counseling, apart from the benefits of family planning, ito dapat yung pinapakita natin sa ating mga couples and women, no? Ito kung correct and consistent use, ito po yung numerong pinapakita natin sa ating mga datos o sa ating mga study na mataas ang effectiveness niya. Comparing these with, for example, withdrawal, na mataas ang kanyang failure rate. Okay, mataas ang kanyang failure rate or even yung hindi paggamit ng isang method. Mataas din ang kanyang failure rate. So this is actually part of our counseling, no, sa ating mga kababaihan. Next, please. Okay, so ito I will just go in passing, no. So itong mga short